So we are going to get you live updates from the Ridge Church, where the one-week memorial service of the Vice President is currently underway. But before that, we'll treat floor cases in an emergency room. If you sign a consent form, that's the solution being preferred by the Greater Accra Regional Hospital to the worrying instances of life and death cases being turned away from hospitals due to a lack of bed. And speaking to Kojo Yangsing, the head of emergency medicine at the Greater Accra Regional Hospital, Dr. Emmanuel Ahiagle, says the consent form is one of many innovations his team have introduced to ensure they never have to turn away a patient in need of life-saving emergency care.
Imagine you're in an accident, or perhaps you have some medical emergency, a heart attack, and you're brought into hospital. You're likely to be brought to a place like this, the emergency ward at the Greater Accra Regional Hospital. But these days, there is a big fear that emergency cases like yours might be turned away because there are no beds. Is that the case here at Ridge Hospital? Let's find out. Let's speak to the man who runs this emergency center and has designed an innovative way of making sure that if you are brought here, chances are they will save your life rather than turn you away. Dr. Ahiagle, thanks again for speaking to us. Doc, let's talk about this. This is the consent form that has been introduced into the emergency services here at Ridge Hospital. Tell us about it and why you're using this here.
Yes, this consent form was developed here because we are getting more patients to the emergency departments. Like I said, we have 17 beds here at the orange, the red and resuscitation area, where we see critically ill patients. At times, we see patients more than that number. So we've created, stretchers, trolleys, wheelchairs in between. When they come and we need to put them on the trolley or the wheelchair, they need to sign this consent form, which has been developed by the hospital management. They read through if they prefer to be in a wheelchair whilst we look for an alternative bed for them. Because what we do here is we transfer out patients to the ward once there's their beds upstairs, the fourth floor or whichever floor. So when they are available beds, then the patients move from the wheelchair or the trolley to the bed here. So this consent form will serve so that in case there's any complication as a result of sitting on a wheelchair or the trolley, which we call floor patients, you not query or you not blame the hospital for that. So it was developed recently. So it says that the medical staff and management board of the hospital, Ridge Hospital, then you write your name, I thereby agree that I should be nursed on a chair or wheelchair after being informed that there is no bed available in the emergency ward or the resuscitation area. I totally agree that should anything happen to me, I hold neither the caregiver or this noble facility responsible but myself.
I'm curious. It says that should anything happen to me, I hold neither the caregiver nor the facility responsible. But you do have certain standards that have nothing to do with whether a person is in a bed or a chair. Yes. So if someone is given the wrong medication, for example, that's got nothing to do with whether they are in a bed or a chair. Or if someone is not seen to within the requisite time as triage requires, that is nothing to do with whether they are in a bed or a chair. So if anything goes wrong with a patient, and it's nothing to do with where they were when they were treated, they still can't hold the hospital responsible?
No, this one is different from what you are talking about. No, we developed this because it's not everybody who would like to be seen in a wheelchair or in a trolley. Because once a patient comes to the hospital, the patient should be dignified and given an appropriate place to lie. But sometimes we become overwhelmed. You'll be here, whether the place is full or not, ambulance arrives. The patient who is critically ill. So you can't say the patient should go to another facility. You have to do something. And before we even refer the patient to another facility, say Kolebu, for example, we need to stabilize the patient and call and refer the person appropriately. In this case, we need to make provision for the persons to be seen here. So trolleys, you can see that there are stretchers, ambulance stretchers there. Sometimes we let the ambulance drivers keep the patients on their stretchers for a while until we are able to move the patient to the next level or get the appropriate bed to put the patient on. This is what we are referring to. There are instances where patients have come and they are not willing to sit in a wheelchair and wait. So they go to another facility. Because the law, according to the Ghana Ministry of Health policy, any patient who comes here should be triaged. You wouldn't say there's no bed, so go to another facility, be triaged. Then the first aid is given before, if we call another facility before you can send the patient there. That's why we developed this. So if you're not comfortable staying in a wheelchair or sitting, waiting for a while, you may decide on your own accord to go to another facility.
I guess it's the particular wording of this, should anything happen to me, that I'm asking about, because it seems to cover all manner of situations, including situations that have nothing to do with the fact that you're looking after the patient in a wheelchair or a stretcher. So I give the example of if, let's say, you give the wrong medication.
No, that is not included here.
Yes.
This one is related to sitting on a wheelchair, because it stated here that I hereby agree to be
nursed in a chair or
a wheelchair after being informed. That's what we are referring to.
Yes.
But medical errors, those ones they happen, but that's not the right form of addressing that.
Right. So this does not indemnify the hospital from malpractice.
Not at all.
Right.
No, we developed this because of the upsurge of no bed syndrome, which is happening now, so that no patient is turned away from our facility.
How is it working?
We are using it and it's working. Like I said, a couple of weeks ago, a few patients came and they were supposed to wait in the wheelchair. They weren't comfortable enough. So the relation said, no, they want to go to a private facility. And they went. In this case, we did not ask them to go because there wasn't a bed. They went on their own accord because they had signed this and they weren't comfortable signing this, applying their signature. So they left. So it's working for now. Maybe the wording could be changed as time goes on. This is a temporary measure the department or the hospital is coming out with until we get a formalized one from the Ministry of Health or from the Ghana Health Service, so that will be more to cover every facility in the country.